We're going to go over maximizing your day with simplified workflows. So, as you guys are probably very busy, let's just go ahead and dive right in. I'm going to kick it off with just an agenda of what we're going to go over in today's presentation. To start, we're going to go over the main problems that independent practices have with its daily efficiencies, the recommended solutions to those problems. We're going to touch on who Updox is in terms of its relationship with your eMD Solution Series. We're going to talk about why Updox should matter to you guys and dive into some of the solution highlights that truly maximize the hours in your day, as well as add some more time back to your day. So first, we're trying to tackle the problems that take up a lot of your staff time and a lot of your time as well as an independent physician. We're going to try to flush out the little things that you can do to counteract these problems. So to start off, what is blocking in your day? Well, we've heard that over 51% of physicians are feeling burnout. So that means the top causes, well, the 5 top causes, 3 out of 5 of those are related to your workflow on a daily basis. Specifically, bureaucratic duties, requirements added to your tasks, just overwhelming work overload, and administrative stressors. Lack of inoperability with your EHR, not necessarily with eMDs specifically, just meaning a lot of the solutions you might be using aren't necessarily talking back and forth with your EMR. Those requirements necessary for reimbursement, so MACRA and MIPS, as the reporting season comes to an end on the first haul of that, and you start to get ready for possibly doing some of those quality measures and improvement activities this year, you're definitely going to have some changes in your workflow from that. Improvements in patient engagement, that's stressed in improvement activities and quality measures as well. The transition from volume-based to value-based care is definitely going to add some hurdles in there. And then unsecure communication. So if you aren't operating in a HIPAA compliant way, that's going to add some stress or some problems in your practice, or just lack of follow-up, whether that be from a patient or another provider or referral source. That's going to add a little bit of backup or blocking in your day as well. So you have very little control over the majority of the things listed here. So how can you possibly expect to be able to prevent these problems from taking up so much of your time? The recommended solutions will probably drive you even crazier than the problems do. Oftentimes, people that are not in your line of work or profession have a lot of answers or suggested answers for you. Most times, although they're appreciated, the advice doesn't always exactly connect to the actual workflow you have in place in your practice. So some of these solutions that are recommended are creating a stress-free environment in your workplace. That's sometimes laughable, as we have little to no control over the things causing us stress in our practices. They suggest that you get more time in your day, which, as I said here, it's easier said than done. An unfaltering line of communication, whether that be streamlined communication with your patients or other providers or even internally. They suggest that you have more staff to take care of the daily demands as they begin to grow. That's not always possible. They require hardware to implement initiatives in your practice, which is sometimes bulky, takes up room. You guys don't really want more hardware. You already have your fax machine, your printer, your computers. With all of that stuff in your office, it's just taking up space. So mental clutter as well as physical clutter in your practice. And some suggest that you get more solutions for reporting. So as MACRA and MIPS requirements kind of jump up at you, they say you should start implementing even more and more solutions than what they're already suggesting for your day-to-day workflows. So some of these solutions just present new lines of problems. So multiple solutions, that's bouncing back and forth, hindering you from actually taking advantage of all of the time in your day. More ROI out the window, so you're going to have to implement paying for these solutions. That's going to take up time. You have to research and acquire specific solutions. You have to train your staff and then implement and execute these solutions. So when do you actually start solving the administrative problems that you're running into on a daily basis? So moving forward into the digital age, you need solutions that aren't hindering your process. So Updox has built key solutions that run in the background of your already current workflows, and we do it in one location. So we've got easy setup and automation that creates consistency in your daily workflow. We provide on-the-fly messaging between staff and yourself to directly message with patients as well as referral sources. And Updox has also supplied independent practices with customization that allows you to tailor your messaging to fit your personal style and strategies in your practice. So who is Updox? If you haven't already heard, which I'm sure a lot of you have heard, our partnership with eMDs, Updox was started about 8 years ago by a doctor to help other practices as he was frustrated by the lack of solutions and software built and available specifically for independent practices. So from the very beginning, our mission has always been to help practices reduce manual operations that may be taking away a lot of the time spent on patients in your practice. So we try to help make your life easier by giving you more time to focus back on your patient care. So specifically, Updox is a communication platform built by physicians for physicians. Right now, we have over 56,000 providers using Updox with 300,000 users and always growing. We have over 100 EMR integrations, including eMD Solution Series. And that covers over 72 million patients, or 18% of the US population. So Updox truly is your single source for patient and provider communication. At our core, Updox is a communication platform, obviously, designed to help the independent practice create the best workflow possible. So we've built solutions to counteract those challenges you face on a daily basis. Specifically, we've created solutions like electronic fax and document management, our patient portal, on-demand patient notifications, automated appointment reminders, and then secure messaging in your workplace as well. So today we're only going to touch on a few of these and highlight the importance that they can help solve some of those problems in your practice workflow. So first we're going to kick it off with our patient engagement tools. That's critical for your practice, whether you believe in patient engagement or not. Obviously, a more engaged patient is going to be more of an advocate in their own health, so improving overall wellness for you and every patient in your practice. So we'll step through just a couple of these solutions that help build that patient engagement. First off, we have our automated appointment reminders. They have just important functionality to alleviate the time spent manually calling patients, obviously. So we can reduce and even eliminate the no-show rate that you have. I think the average of 100 appointments a week that a practice may have, we know that 7% don't show up. So 7 of those appointments we can help get back on the calendar. We help free up staff time spent manually reminding your patients. And then appointment reminders also help fill those canceled appointment slots. Just in case you do want a full calendar, we can help get you there. And we help you engage patients in their care. So the Updox difference is that you set up and let it run, and most times staff won't even know that it's working behind them unless they were a part of the implementation. So they're spending a lot more time off the phone. That's pretty much the only hint they'll have that something's working. So we've recently interviewed Dr. Phil Boucher. He's actually an eMD Solution Series user. And this was one of his quotes. A lot of my staff members don't even know what it is because it all runs in the background. But those that do have had a really easy experience starting it up. Only a few key staff members were necessary for it to be totally functional. And he got it up and running within just a couple days of training of staff. So not only is it going to free up a lot of staff time, kind of make your workflow a little bit easier, but it's really, really easy to set up. So with one hit with our support team, mind you, you get free training and free support with Updox. So in one training session, our support team can set you up for all of your reminders based on patient preferences. So they are customizable as well. You're able to pick, based on your patient preferences, how you would like to remind your patient. And it's up to 3 ways. So if your practice for some reason only wants to do one phone call for every single patient appointment, that's fine. You just check those boxes and set it up the way you want it to be set up for your workflow. But again, you pick between an email, a telephone call, or an SMS text message. And you can also do a human voice and preview that as well. So along with the reminders, we have our reminders dashboard. So there's always an audit trail with Updox. You have the customization that makes it really easy, but you're also able to track exactly what your practice is doing. So if you ever feel like the solution may not be working for you, you can come back to the dashboard and see exactly who's confirming, who's declining. You can look up trends in your demographics of patients. All of it's reportable within Updox. So just another quote from Dr. Boucher. I was shocked when it only took a few hours to transition from our previous reminder service provider to be up and running with Updox. It was so easy to set up and automate and run seamlessly in the background. Again, just a key functionality for your staff. They won't even know it's there. Once it's set up, you can just let it run. The second tool we're going to go over for patient engagement specifically is our on-demand patient notifications, or blast messaging as we like to call it. It's a significant tool that can be used for patient engagement as well as building out your referral network. So as you're trying to boost patient engagement, you can tailor customized messages. Some use cases are birthdays, inclement weather. If you live on the East Coast like I do, you know it's 70 degrees one week and it's snowing profusely the next. So if for any reason you have an emergency closure of your practice and you need to let your staff as well as all of your patients for the day know, no problem. Updox Blast Messaging connects directly to your address book, so you can pull customized lists based on everyone in your address book, or you can segment different layers of your patients. So here you can see you build personalized messages, or we can provide you with out-of-the-box scripts. And then from there, you can segment your list. So we have some out-of-the-box lists that we've already built up. So if you wanted to target just your female patients, just your male patients, or your birthdays, or appointments from the last 30 days, or yesterday's appointments, we've got those all built in there for you. Or if you wanted to target your own list, your staff can set that up directly with support and training, and makes it really easy to just send out messages with one click. And as you grow your business, it's hard to stay in contact with a lot of those physicians and specialists vital to your calendar. But with blast messaging, you're able to build lists directly from your address book, as I said, and send out accordingly. So you're no longer having to locate different phone numbers, fax numbers, or emails. You can just add them into your address book and send directly from there. These small messages allow you to remain front of mind and visible to providers, your staff, and your patients. So just like our reminder solution, you're able to report on your blast messaging. So if for some reason you have a closure of your office and you need to send it out to everybody in your address book, no worries. With one click, you can do that. But sometimes you don't know if everybody got your message and you want to ensure that not one of your patients is showing up at your door while you're closed. So you can go back into the dashboard here and actually see exactly who your message was sent to, how it was sent, when, the date and time, and whether or not it was delivered. If it was not delivered for any reason, this makes it really, really easy. If 3 out of 100 people didn't get your message, rather than calling every single person on your list, you can just target those 3 people manually rather than wasting all of that time calling everybody on the calendar for the day. Again, customizable just like our reminder solution, so you have the choice of delivering these messages from SMS text, email, or phone call. Completely up to you, and all previewable as well. So the next set of tools we're going to go over, were actually the first set of tools Updox created for independent physicians. They help improve efficiencies and eliminate time spent on manual process. So the first solutions were electronic fax and document management. Specifically, the universal inbox. This is actually where all of your messages go. We're going to talk about fax for a little bit, but even your cancellations from appointment reminders will show up directly in this inbox as well. So anything going on within your practice, rather than jumping around from solution to solution, as so many people suggest you should do, you have everything living in one place that speaks seamlessly with your EMR eMD Solution Series. So here you can see we've got all of the messages centralized into one location. Messages are all color-coded, so that means your direct secure messages, your portal messages, emails, appointment cancellations, and faxes all end up in the same place. We do have different colored tags as well that you can choose from. So if you know, if you have 5 physicians at your practice and you know they all want to only see the messages that are targeted for them, you can have one staff member tagging things accordingly so that when they show up for the day, those providers are only seeing things that are associated with their patients. So the universal inbox obviously is where we store all of these things and make it super easy and color coded for you guys. So just a quick video here. We also have some specific features that make us a little bit different than any other eFax option. We have the drag and drop feature. As you can see, my desktop is a mess, and if you're oftentimes saving forms or different patient information, PHI, onto your desktop, first of all, that's not HIPAA compliant or secure. Updox provides you with a secure and HIPAA compliant inbox where you can actually just drag and drop those documents. So if you think for any reason it's going to be too difficult to get documents over to Updox, as you can see here, super simple. Another key feature of the electronic fax and document management is the robust editor. So our editor is really, really cool with a bunch of different features that we're constantly updating as enhancement suggestions come through. So as of right now, you can add annotation before filing to the chart or sending out. We have the freehand draw option, erase or redact if you don't want a certain individual that you're sending to seeing something specific on the document. No worries, just take it out of there. You can highlight things. We also have provider signatures in Updox, so you're able to just one-click sign a document if you need to. And you can also pre-populate these forms just so they're in your inbox and ready to go, and then edit and send out as needed. So again, just a quick video to show you just how easy the editor is. This was one of my first times walking through it as an Updox user. And as you can see, it's pretty intuitive. Your staff won't have much trouble as long as they've used Microsoft Word before or an editing feature similar to that. Even your email, we make it as easy as that. Another quick video is our compose screen. So if you are sending over to the EHR or if you're trying to send out a fax, you can do that simultaneously. And if you are sending to the EHR, we've mimicked the functionality that you already have with DocMan. So you're able to pick your category, subcategory, tag a specific user in mind, and then mark a priority and send it over to the EHR, and they'll see it the same way they do now. So just to wrap everything up, the Updox difference here is that we're not just a base solution to put a Band-Aid on your problems. What we do is really provide connectivity among all of the people you're talking to on a daily basis. We've really tried to research the independent physician's workflow over the past 8 years and develop solutions that are really fixing your problem. So creating a more paperless practice, alleviating all of that time spent on manual process. We've done all of that, and we've also tried to make it easier for you to connect with everybody you talk to on a daily basis. So whether that be a pharmacy, a payer, a patient, a provider, you have all of that centralized in one easy place for your practice. So how do you get started with Updox? I'm sure Allison can answer this question for you, but obviously you can contact us at the number below or email our sales team there. We do have a 15-day free trial that allows you and your staff to see the benefits of Updox working for you before you sign on the dotted lines, as they would say, but we also offer no contracts. So it's a month-to-month subscription similar to a magazine order. If you want it to end for any reason, simply let us know before your bill date and we will turn it off for you and give your number back. No hard feelings. We also offer free training and free support. And one big differentiator with Updox is we are no hardware required. We are all web-based and accessible anywhere with an internet connection. So we try to make it really, really easy for you and your staff to have access to all the documents you would at the practice.